Today we will discuss about uh, clavicle bones anatomy. So let's start. Clavicle is the Latin word which means a small key. It is a modified long bone, a S-shaped shaft with the two end, medial end and the lateral end. Medial end is the rounded, while the lateral end is flattened. It supported the shoulder so that the arm can swing clearly away from the trunk. The clavicle transmitted the weight of the limb to the sternum. The bone has a curved part. The bone has a curved part that is called shaft. This is the shaft. And as we already discussed, the two end. This is the medial, and this flattened end is known as the lateral end. If we talk about its side determination, means how we know that this is the right clavicle or left clavicle. So there are some points. With the help of these points, we can identify whether it is a right clavicle bones or it is a left clavicle's bone. So let's discuss about that point. So the first point is the lateral end is flat. So this is the end, lateral end. You can see that it is a flat comparison to medial end. Medial end is the rounded, while the lateral end is the flat. And second point is the shaft is a slightly curved. You can see that this is the shaft. It is slightly curved with the S shape, so that it is convex forward in the middle 2/3 and the concave forward in the lateral 1/3. So it means that it is the concave forward in the lateral 1/3. You can see the lateral 1/3. This is the lateral 1/3. You can see there is the concave and convex medial 2/3. Medial 2/3. The third point is the inferior surface is grooved longitudinal in its the medial 1/3. If we see that the inferior surface, there is a groove known as the subclavian groove longitudinally placed. So these are the some points. On the basis of this point, we can know that the whether is the left or right clavicle. And there are some particular point about the clavicle's bone, that is it is the only long bone which lies horizontally in our body. Second is it is a subcutaneous. The first bone start ossifying. The only bone which ossifies in membrane. This is the only bone which ossifies in the membrane. At the next point, there is no medullary cavity in the clavicle. So these are the some point, and now we will be discuss the part which have the clavicle. So let's start. As we already know that there is a two end, that is the medial end and lateral end, and between these end there is the shaft. So and we already discussed about its side determination. So whether it is a right or left, for that for that we will be see the flattened end that is placed laterally, and medial end it is articulated with sternum and form the sternoclavicular joint, and where the lateral end articulate with the acromion process of scapula, which form the acromioclavicular joint. So the clavicle is made up of the 2/3 medial and 1/3 is the lateral part. So let's start the 1/3 lateral. So 1/3 lateral is the, as we already knows that this is the flattened part of the clavicle. It's situated laterally. It has a two border. It has two border. That is the anterior border, and this one is the posterior border. As well as there is two surface. the superior surface and inferior surface. The superior surface is the subcutaneous and the inferior surface present a elevation called conoid. So this is the conoid. As we know, the superior surface is cutaneous. We can palpate it, but the inferior surface have a conoid process. And a ridge called trapezoid ridge. There is a ridge known as the trapezoid ridge. Now we will discuss the medial two-third. This part known as the medial two-third, that is the convex forwardly, and the lateral end is the concave forwardly. So medial two-third of the shaft is a rounded, as you can see that this is the rounded, and it have a four surface. So that is the anterior surface, it is the convex forward, and posterior surface, it is the smooth. The superior surface is rough in the middle part. The superior surface is rough in the middle part, and the inferior part have the rough oval impression, as you can see. The lateral half of the surface has a longitudinal groove. The lateral half of the surface has a longitudinal groove. This is the longitudinal groove known as the subclavian groove. Now we will discuss about its end, that is the lateral end and the medial end. The lateral end, or this is also known as the acromion end, it is a flat end, as we already discussed. From the above downward, it bears a facet that it articulates with the acromion process of the scapula. As we already know that this facet is the articulate with, you can see this is the facet. With this facet, it articulate with acromion process of the scapula and made a acromioclavicular joint. The medial or external end is the quadrangular and the articulate with the clavicular notch of the manubrium sternum and makes the sternum clavicular joint. So this is the anatomy of the clavicle, and we in this video we discuss about the site determination, the end edge and the shaft. Next video we will be discuss about the muscle attachment about of the clavicle.